One argument is that euthanasia violates the Hippocratic Oath, as it is said, "I will neither give a deadly drug to anyone if ever asked for it, nor will I make a suggestion to this effect." However, such an oath has been modified in a number of occasions, such as the practice of surgery and abortion. Instead, the focus should be on the phrase "to do no harm." Doesn't harm include forcing a patient to suffer towards the end of a terminal illness? Doesn't harm include watching a patient face a painful burden? Doesn't the ending of such suffering and pain fit the definition to do no harm, to provide mercy, to provide help? Euthanasia is nothing but the escape of an inner rampant beast, clawing and destroying someone from the inside. Others say laws against euthanasia are in place to prevent against abuse and to protect people from unlawful doctors. However, if specific laws were legislated that would target and protect against such abuse, wouldn't that diminish this argument? In the Netherlands and in Belgium, there has been an increase in the amount of patients that are euthanized, with only a few incidents of malpractice, since their laws are strictly enforced. Palliative care, the care in which the main focus is relief from symptoms and pain from serious to terminal illnesses, is often the alternative. But this may not always be an option for terminal illnesses that are accompanied by chronic pain. The final argument boils down to ethics. Is euthanasia murder, or is it granting mercy? Is it immoral to grant someone a right to his or her own life, and the right to choose the condition of their inevitable death? Is it wrong to provide a human dignity and set the scene for their own demise? Death is a private affair. When we think about death, most of us imagine passing peacefully, surrounded by our loved ones, looking into their eyes, one by one as we say our goodbyes. Let's preserve that. The first step is to clearly define the boundaries of euthanasia. The main obstacle legislators and advocates face is the slippery slope argument, which is both complex and a philosophical concept that asserts that one exception to a law like murder will be followed by more exceptions, cascading to complete disorder. However, this can be avoided if we clearly define the law and if we learn from our European predecessors by adding strict addendums to previous published guidelines that cannot be abused. Let's continue to push legislators to support euthanasia. Let's continue to raise awareness. Let's fight to let doctors do their job and provide their patients with the best possible care.